Good evening, guys, and today I will discuss the basic principles of cellular injury. In the previous lecture, I have discussed cellular adaptations in response to stress, for example, hyperplasia, dysplasia, atrophy, and metaplasia. So you can see the previous video. So let's get started. First of all, the basic principles of cellular injury occurs when the stress exceeds the cell's capability to adapt. It means the cellular injury. It is the definition of the cellular injury. When the stress is so intense that our cells are not capable to adapt, like the cellular adaptations, so it results in the cellular injury. And it can be necrosis, it can be apoptosis, it can be cellular death. So, but here we will discuss only the basic principles. First of all, the likelihood of the injury means that which factors are dependent. The first is the type of the stress. It means that either the stress is hypoxia, either the stress is trauma, or any chemical agent. It depends on the type of stress. The second is the severity. It means that the intensity, and it also includes the duration of the stress occurring on a cell. And the third is the type of the cell. For example, our body has variety of cells. The neurons, which are brain cells, are more susceptible to ischemic injury. For example, if we cut out the oxygen supply to the brain, there are more chances that our brain cells die early than our skeletal muscle cells. So they are more susceptible to ischemic injury, like cutting the blood. And skeletal muscles are more prone because they are not very susceptible. Neurons are highly sensitive to the oxygen supply, and if we cut about for 2 to 3 minutes, they can result in the irreversible neuronal damage. The next thing I want to highlight here is that when there is a mm, slow developing ischemia, for example, if there is renal artery atherosclerosis, it develops gradually. It is not a sudden onset. Like the renal artery begins to atherosclere via passing time, and it does not occur rapidly or instantly. It results in the atrophy of the organ. Okay, this is the example of slowly developing ischemia. But the acute ischemia, for example, there is an embolus or thromboembolus. It results in injury. It results in ischemia. It results in the injury of the particular organ in which the artery is embolized. So slowly developing ischemia, for example, renal artery atherosclerosis, results in atrophy. And acute ischemia, which is of shorter duration, it occurs suddenly. It results, for example, renal artery embolus results in injury. The various causes of cellular injury are written here. First of all, inflammation, any autoimmune diseases, for example, rheumatoid arthritis or systemic lupus erythematosus. These are inflammatory responses of the body, and it also results in prolonged duration and results in the cellular injury. Nutritional deficiency or excess in the Western countries, most of the causes of the cellular injury are nutritional excess and hypernutrition. And in other countries, for example, in African regions, the nutritional deficiencies are the main cause for the cellular injury. Hypoxia is the oxygen deficiency or supply to the tissues, and it is the most common cause for the most of the cellular injuries. Trauma, any trauma like physical or mechanical, for example, road traffic accidents or a fall, can result in trauma to a particular organ. Also, genetic mutations. Mutations in particular genes can also be the cause of cellular injuries and may induce apoptosis or necrosis in certain ways. So, first of all, we'll discuss the hypoxia in detail because it is very important and the most common cause of cellular injury. The definition of hypoxia is the low oxygen delivery to the tissues. It means that oxygen delivery to the tissues is imparted, and hypoxia is resulted from ischemia. When the blood supply to a particular organ is cut off or is hindered in any way, it results in hypoxia. Why hypoxia is very dangerous to the cells? It is because the oxygen is very important in the oxidative phosphorylation which occurs in the mitochondria, and through oxidative phosphorylation we obtain ATP, and ATP is required for the various functions of the cell. So oxygen is the final acceptor of electron in electron transport chain. We'll discuss in biochemistry playlist, but for now, the oxygen is very important in oxidative phosphorylation. When there is low oxygen, so oxidative phosphorylation can also not occur and results in the deficiency of ATP and results in cellular injury. There are various causes of hypoxia. First is the ischemia, as I have told you that cutting the blood supply to an organ results in hypoxia. We'll discuss the causes one by one. First is the ischemia, second hypoxemia, and third is the decreased oxygen carrying capacity of the blood. First, ischemia. Ischemia means that decreased blood flow through an organ. It means the word through is very important here because here is an example. If this is an organ, it has an arterial supply and a venous drainage. Okay, it has two of them. The blood flow from here and is drained via the veins. It is a blood flow through an organ. So there are three conditions we can discuss in the ischemia. First is that decreased arterial perfusion. It means that atherosclerosis or arteriolosclerosis, any type of um, sclerosis can occur in the inside of the arterial wall, and it hindered the flow of the blood to an organ. It is also a consequence of ischemia. Okay, the second is the decreased venous drainage. Most of the students don't think of the decreased venous drainage. For example, if there is a venous congestion here, for example, if there is venous congestion, so blood flow through an organ, of course, it is not flowing through an organ, it is decreased or it is imparted. So, decreased venous drainage it also results in ischemia. The most best example for this condition is Budd-Chiari syndrome. Budd-Chiari syndrome, it is high yield, and it is caused by the occlusion of the hepatic, not arteries but veins. It is the congestion or occlusion of the hepatic veins that drain the liver. When the blood is not draining properly, it results in the ischemia. Here the blood, deoxygenated blood will accumulate, and the oxygen inside the organ will become low, and it results in the cellular injury. And Budd-Chiari syndrome is of high yield. As we are discussing the Budd-Chiari syndrome, the two causes are also very high yield to remember. It is caused by polycythemia vera. Polycythemia vera is a condition in which the RBC count, uh, reticulocytes or erythrocytes count, become high, and because of that the blood become viscous. So viscous blood is more likely to be congested or more likely to be occluded in the veins, so it results in the clotting of the hepatic vein. Also, other condition or cause of the Budd-Chiari syndrome is the lupus anticoagulant disease. As the name suggests, it is anticoagulant. Okay, it is a condition in which there is the occlusion of the hepatic veins and results in the Budd-Chiari syndrome. Okay, the third condition here we want to discuss is the shock. It is a generalized hypotension. If there is the decreased blood pressure, systemic blood pressure is reduced due to any condition, it results in the poor tissue perfusion. Of course, the blood is not properly delivering to the particular organs or tissues. It also results in ischemia. And perfusion is defined as the delivering of the oxygen and nutrient to the tissues through the systemic circulation. So as far as ischemia is concerned, three things are to be noticed. That first is the decreased arterial perfusion, second is the decreased venous drainage. Any type of occlusion or congestion can result in ischemia, and third is the shock or hypotension, which results in the poor perfusion of the particular tissues. The second cause of hypoxia is hypoxemia, and it is not like ischemia. It is a condition in which there is low partial pressure of oxygen in the blood. The students confuse the term hypoxia and hypoxemia because these are used interchangeable. These are interchangeable, but here the most important thing is the partial pressure of oxygen in the blood. And when we say the term hypoxemia, it means that partial pressure of oxygen in the arterial blood is less than 60 mmHg and oxygen saturation is less than 90%. When these two conditions are fulfilled, it means that this is the condition hypoxemia. A partial pressure less than 60 mmHg and the oxygen saturation, okay, and is less than 90%. Or SaO2 is also defined as the percentage of oxyhemoglobin. It means that number of oxygen molecules bound to the hemoglobin. It is less than 90%, so we can say that it's hypoxemia. Revising the previous terms, first term is the FiO2. We need to revise them because it is high yield in practicing the questions or vignettes. So first of all is the FiO2. FiO2 is the oxygen in the atmosphere or environment, okay, concentration of atmosphere. And from a FiO2 the oxygen is delivered to the lungs, okay, when we inhale the air. And in the lungs the alveoli are present, so pressure of oxygen inside the alveoli, it is P capital AO2, okay. And from P capital AO2 the oxygen is driven through the interstitium into the um, blood, and the partial pressure of oxygen in the arterial blood is P small AO2, and we are concerned with the P small AO2, and the condition in which it is less than 60 mmHg is known as hypoxemia. And from P small AO2, which is the partial pressure of oxygen in the arterial blood, we derive the SaO2, the percentage of oxyhemoglobin in the blood. Oxyhemoglobin means oxygen bound to the hemoglobin. Okay. First condition is the high altitude. When the person is at high altitude, for example, any mountain area or Mount Everest, it there the as all you know that the pressure of the air is low. So from these terms, from these four categories, which of the pressure is low in the mountains? Of course, FiO2 is less. So it's decreased barometric pressure of FiO2. And when the FiO2 is decreased, of course, P capital AO2 will be decreased, and then eventually P small AO2 will be decreased, and it results in hypoxemia. Okay. When there is hypoventilation means that the ventilation is not proper and we are inhaling air not with the deep breaths but partially, okay. It results in increased of the P capital A CO2. When there is increased P capital A CO2, and eventually it results in decreased in P capital A O2, because these two gases are remained in a particular balance inside the body. When one increases, the other should decrease to compensate. Um, Here, due to the hypoventilation, the carbon dioxide accumulates, and because of that, the oxygen will decrease eventually, and it causes also P small a O2 will decrease obviously, because these are connected. So hypoventilation. The third is the diffusion defect. You know that alveoli, for example, this is an alveoli. This is the interstitium, and after the interstitium, it is the blood. These are the bloods. So from the alveoli, the oxygen diffuses through the interstitium into the blood, and carbon dioxide also go in the opposite direction. But imagining that, for example, if there is defect in this interstitium, or it is a thicker, it becomes thicker in diseases like interstitial pulmonary fibrosis, in which the diffusion barrier becomes thicker. So will the oxygen and carbon dioxide diffuse easily? Of course not, because the barrier is thickened. So ultimately it results in decreased in P small a CO2. Okay, and it's the term used in hypoxemia. I hope you understand these terms. FiO2 is for the atmosphere, P capital AO2 is for the alveoli, P small AO2 for the blood, and SaO2 for the percentage of oxyhemoglobin in the blood. The third cause of the hypoxia is the decreased oxygen carrying capacity of the blood. Decreased oxygen carrying capacity of the blood can be due to various reasons, including the hemoglobin loss or dysfunction. Hemoglobin is very important globular protein, and its function is to carry oxygen, and it is present in the RBCs. And any defect or dysfunction of hemoglobin can result in the carrying capacity defect of the oxygen. First is the anemia. Anemia means the decreased RBC mass. It means that RBCs are not enough to carry the oxygen. So where is the defect? Think logically. First of all, the in the atmosphere, is the oxygen is good? Yes, it is normal. In the alveoli, the oxygen is also normal. In the blood, oxygen is also normal, and in the oxyhemoglobin is also normal. Why? It's because, for example, our body has 3 RBCs in total. There are million of them, but considering the example, we have 3. FiO2 from the atmosphere is normal. After that, it comes into the alveoli, and it is also normal. And inside the RBCs and inside the blood, the partial pressure of oxygen is also normal. And here is it's also normal. In 3 of them, it is normal. But if there is anemia, we remove one RBC. So in other two, the oxygen saturation is normal. But due to decrease in the RBC mass, it results in anemic condition. Okay? It is not a defect in oxygen carrying capacity, because other two RBCs are fully saturated, but due to decreased in the number, only we suspect it's hypoxemia. Okay. After that, carbon monoxide poisoning. It is a very dangerous colorless and odorless gas, and it is we can find it from the smoke from the fires or gas heaters, exhaust from the cars. For example, if there is MCQ or clinical scenario in which we suspect a patient that comes from a fire or exhaust from the cars or gas heaters, so you can suspect of carbon monoxide poisoning. And why it's dangerous? It is because that carbon monoxide has 100 times more affinity than oxygen to bind with the hemoglobin. and it binds with the hemoglobin 100 times more readily than the oxygen. So in this condition, the partial pressure of oxygen in the blood is normal, but the oxyhemoglobin, or the concentration of oxygen bind to the hemoglobin, become reduced. This is a condition in which we can see carbon monoxide poisoning. The clinical findings in the carbon monoxide poisoning is the cherry red appearance of the skin. It is the paradox, or it is a paradox that when the person is hypoxemic, so why we find the red appearance of the skin, and it can be we can be confused in this way. It is because that hemoglobin and carbon monoxide join to form carboxyhemoglobin, and due to that there is the cherry red appearance of the skin. Okay, it's not because that oxygen is more or arterial blood is more. It's not a condition related to that. And okay, and early signs of exposure for the carbon monoxide poisoning is headache. It's very important that any patient coming to the doctor and saying that he has headache in the early signs, so it can be carbon monoxide poisoning, and after that long term exposure can lead to coma and eventually death, because the oxygen is not sufficient in the blood. And people use it to commit suicide. It's because they can turn on their cars, or they can turn on the gas heaters and shut the garage and shut the door, and it can result in the carbon monoxide accumulation in the blood and eventually results in the death. So it's the way to commit suicide. The third condition we need to discuss in decreased oxygen carrying capacity is methemoglobinemia. Methemoglobinemia is a condition in which the iron is oxidized. So first, normally the iron is in the Fe2 plus state, and it is the state which can bind the oxygen. How we remember this? Fe2 plus binds O2. So 2 2. The iron in the state 2 can binds the O2 perfectly, but maybe due to oxidative stress, for example sulfur drugs or nitrate drugs or newborns, due to the oxidant stress or oxidative stress, the iron can be oxidized to Fe3 plus, and it is not the state in which it can bind oxygen efficiently. In this condition, the PaO2 is normal. Of course, there is no defect with the partial pressure of oxygen in the blood, but SaO2 will be decreased, like in the carbon monoxide poisoning. Okay, and a classical finding in methemoglobinemia is the cyanosis and chocolate colored blood. In the carbon monoxide poisoning, it was cherry red appearance, and in the methemoglobinemia, it is cyanosis due to less oxygen, and it can be chocolate colored blood. The treatment of the methemoglobinemia is that we inject intravenous methylene blue. Methylene blue is an agent that can help reduce the Fe3 positive back to Fe2 positive state, and when it is reduced back to Fe3 positive reduced back to Fe2 positive, so again this is a state in which oxygen can be bound to the iron. I will understand the concepts relating to the hypoxia. There are three causes: ischemia, hypoxemia, and decreased oxygen carrying capacity of the blood. And some important terminologies are used here, like Budd-Chiari syndrome and carbon monoxide poisoning classical findings, and methemoglobinemia classical findings. So this was for today, and I will see you in the next lecture. Goodbye.